Okay, so I've completed my first cycle of Lenalidomide and Dexamethasone. I go back to the clinic tomorrow for more checks and to see my consultant, Dr. Crawley, and hopefully see how he thinks things are going and get more details what's going to happen next. I've found out that my protein count has dropped back down to 9 again, which is a definite improvement from around about the 14 or 15 it was at my last clinic appointment. So it's obviously having some effect. We just don't know exactly how big that effect is, but protein's dropping is definitely a good thing. Most likely thing for me to happen is for me to have to do another cycle of the Lenalidomide and Dexamethasone starting tomorrow, so I'll feel a bit rubbish, but hopefully not too bad since it's my eldest daughter's 14th birthday on Wednesday. Hooray, 14 years old, oh my goodness. After that, I'm also going to talk to Dr. Crawley tomorrow and try and find out what his views are on going beyond the Lenalidomide and Dexamethasone, as he said I'd probably only have 2 cycles of this, so I'm not sure whether it'll be a case of 2 cycles then wait and see if proteins start creeping up again, or whether it's going to be more a case of 2 cycles then that gets me ready for a stem cell transplant. I get the feeling that's where he was heading. And if I'm honest, well, it's probably a weird thing wanting to go for treatment, especially something as dangerous and as harmful as a stem cell transplant. I'm actually almost thinking it's better just to get it over and done with. I don't know if that's the right approach or not, but I suppose it's one of those things where you sort of think, well, do you want to have maybe treatment and then 2 or 3 months off maybe, or 4 or 5 months off, and then suddenly come back again, this hangover, and have to go back for treatment again? Or is it better just to bite the bullet and go for maybe, well, 3 weeks in hospital in isolation, feeling really rubbish, some really horrible side effects from that, and then maybe sort of 3 to 4 months recovery afterwards at least, but then potential of sort of several years of what I had been enjoying over the past sort of year or 2. I don't know, it's one of those difficult things and something I'll have to really think through and talk with Dr. Crawley about tomorrow, I guess. But at the moment my view is I probably want to go for the stem cell transplant, which might sound a bit insane to some people, but there you go, that's me. How have I got on over the last 3 weeks? Well, yep, I felt really tired. The Dexamethasone made me feel quite moody and grumpy. I was grumpy daddy for a bit. I guess I felt more aggressive at times after a day or so afterwards. I got some nausea side effects ranging from mild to pretty bad, even taking domperidone anti-sickness tablets over the 3 weeks when I was actually on the treatment, and also I sort of got a couple other sort of various sort of less severe side effects which are more easy to manage. Got fairly regular headaches as well, but that's just something you get used to in the end, I guess. Most interestingly, I guess the most difficult, well, one of the most difficult days was actually the Tuesday after I actually finished, as in my first day off. I actually felt terrible on my first day off and sort of was on and off asleep for most of the day and just felt really ill. When Amanda and the 2 girls got back from work and school, they all looked at me and just said, "You look really ill." So that was quite an interesting one, but I recovered after that, so maybe it's just like a 1-day virus type thing, I don't know. Not sure you get 1-day virus, but you know what I mean, sort of just a quick infection kind of thing. So anyway, that's me. I've seen some friends over the past 3 or 4 weeks, which has been really good and helped keep me going. As most of you know, I play some online games, so there's things like playing Warframe with John and Adam and Joe has really been good, and also things like Clash of Clans, playing with Asma and Ronnie and especially Ellie, of course. That kind of thing has really been good to keep me going, so hopefully I'll be able to spend more time with you guys online as things improve, but at the moment it looks like I'm probably going to be going for another 3 weeks of treatment, so I'll keep up to date and let you know how that's going. But thanks to everybody who's watching, and thanks to everybody who keeps sending me messages and encouragement and everything, and see you soon.